Hey, it's Dr. Trish Leigh, and today I want to go through a brain map interpretation for you. So today we're going to start with a brain map for a person who thinks that they have ADHD when they arrived at this neurofeedback expert's office. Okay, so let's go through this brain map briefly, and I'm just going to go through the eyes closed map, but I will tell you the eyes open map is very comparable. So in this map, let's look at magnitude first. In magnitude, you can see that delta is all green, which means it's functioning at optimal levels. Theta is primarily green, except for we have the two occipital lobes and T4 are running a little low. So this person thinks they have ADHD. Right now we know it's not a very classic ADHD because in classic ADHD, theta is too high. They would be red or yellow. So one of the biomarkers for true ADHD is a theta to beta ratio of 3:1. Now we're going to explore that in just a second, but typically what that looks like is theta levels that are excessively high, red or yellow, and then beta levels that are typically either they're green, they're okay, or they are running a little low. So let's move over to alpha and think about the magnitude there. Alpha magnitude is high at CZ, C4, P3, O1, and O2, which you can see that by the red circles in alpha. So we know alphas run a little high. Now let's get over to beta. Beta is basically light blue across the board. So beta is running low. So that means that fast processing speed for focus is truly running low. So that aspect of the ADD or ADHD brain pattern is there, even though we're lacking that typical aspect of too much theta. So we see it's running low. So that might give us, that ratio of theta to beta, but again, it's not a real classic pattern. But I will tell you, it can manifest as the same types of symptoms. So let's keep exploring this a little bit further. I'm going to skip asymmetry for just a second, and we'll look at dominant frequency, and I'll shrink this a little so that we can look at, that's too much, so that we can think about it in relationship to the magnitudes up top. I won't really be able to do it very well for you, but I guess I'll try to get them all in, because here we go. This is probably okay. So what I want you to think about is that when we look at dominant frequency, that's basically the frequency of that type of brain speed. So when it is green, when that frequency is mid, then that means that basically delta is using a frequency that's around 2 to 4 hertz. So we'll say 3 hertz. That theta is using a frequency of 5 to 7 hertz. That alpha is using a frequency around 10 hertz. And that beta is using a frequency around 15 to 20 hertz. So when we see in dominant frequency, when it's blue, that means that those brain waves, or that processing speed, is running slow. So delta, although it's green up top in magnitude, it's running slow. You can see that they're blue. So delta is actually maybe dragging at the 1 to 2 hertz. So even though it's being used at the proper amount of magnitude, it's functioning very slow almost across the board. In opposition to that, theta is functioning very fast for theta. So theta is supposed to be around 5 to 7 hertz. So this person's theta is acting more like maybe 9 to 10 hertz. You can see how alpha in the frontal lobe is slow. And here's the real important part. Beta is running slow too. So up top, we know that magnitude of beta is too low and beta is acting too slow. So what that will mean is that when a person is processing information, their brain is running slow and is not using enough of that speed in the first place. That will give them difficulty with attention and focusing, and basically it's across most brain areas. So sensory processing challenges, possibly cognitive processing, emotional regulation, all of those types of things. That's the primary thing you want to look at, is magnitude and dominant frequency. When we look at alpha asymmetry, we can see that there's some imbalances there, but I wouldn't be overly focused on them, I guess. We want to see alpha higher on the right than on the left, and beta higher on the left than on the right. And there is some especially in beta. Betas are running low on the left, and we know that that is congruent with what we're seeing in the magnitude of beta being too low and it being excessively slow. Interconnectivity is high, which means that all of these areas are trying to get help from their team players, and they're trying to provide help, except for T3 and T4. It is running low in connectivity, so those areas are not. Again, your main concern is looking at the magnitude and the dominant frequency. So what do you do for a person's brain map like this? My primary concern would be increasing beta at CZ, I would start, or C3, C4 to get a more global training, depending upon their symptoms. If it is more attention and executive function, impulse control and judgment, those skills reside in the frontal lobe, so then the frontal lobe would be most appropriate. The way that I would make protocol selection here is based upon what are their primary concerns. Have them list their 3 top goals for you, and then you can look at which pattern in this brain map is driving those 3 goals that they would like to see change. And you could address those areas for the quickest change that would be kind of the biggest bang for their buck, which would start moving them in the right direction in terms of creating a positive feedback loop in their life. So what we need to do is we need to boost beta, regulate alpha a little bit, but primarily we need to get that beta up. And if delta's running slow, that could be at issue too. Okay, so I hope that helps. This is not a typical ADD or ADHD map that I would see over and over and over, but I can see how this would create the symptoms of difficulties with attention and especially difficulties with information processing. I think of this map as more of a slow processor than an ADD map. And before I go, I'll tell you the difference behind that is when a person has ADD in the classic sense or ADHD, typically it's because there's too much theta being used, which is too much braking. Theta is excessive slow speed, too much use of braking. When we see this brain pattern, it's not enough gassing. So when there's not enough gas, it means that that brain is not processing information in real time because it's not using enough of the fast speed. So although it might create the same symptoms, the driving force is different. So we want to boost it instead of decreasing too much of the braking. Okay, I hope that helps, and let's go change brains and improve lives. Thanks.